This is Jose Merino, Editor-in-Chief of the Neurology family of journals. The Neurology podcast provides practical information to neurologists and other clinicians to help them provide better care for their patients. Thanks for listening and have a great week.
Hey, this is Jason Crowell from Norton Neuroscience Institute in Louisville, Kentucky. Thanks for listening to today's Neurology podcast. Today we have Brian Emmert joining us. Brian is soon to be assistant professor at Columbia University as an epileptologist. He just finished his training, which is an appropriate segue into our topic today, which is an article that was published in Neurology Education on May 16th online. It was in the June 2025 print edition titled Neurology Residency Training in 2022, Insights from the American Academy of Neurology's Resident Survey. Brian, thank you for joining us today.
Thank you very much for having me, Jason.
I read this article and it refers back to several surveys like this, which have been performed over the years by the AAN. Before we get into the topics you surveyed different neurology trainees on, can you tell us a little bit about the background for the study and what the idea is behind it?
The AAN has been instrumental in identifying changes and trends in neurology training throughout the U.S. And what they've been doing is periodically surveying graduating residents about their experiences in residency and what they perceive as their needs as they transition into practice. The last survey was done in 2017, and this one was done at the end of 2022. The goal of these surveys is really to characterize four main things: post-graduation plans, perceived preparedness for independent practice, evaluate what topics that residents feel that they're missing in residency, and prioritize AAN resources to better serve residents and fellows. And these surveys really are pivotal in helping to identify critical deficiencies and areas of need for that the AAN can improve with the neurologic training. These areas that are identified are then addressed systematically by the AAN through the Graduate Education Subcommittee and work groups. Let me give you an example. In previous surveys, graduating residents and fellows have identified a need to push standardization for the fellowship application process and timeline. And the AAN has really worked tirelessly to try to figure out the best way to coordinate that, and have done a really good job of standardizing that process as a result of the findings of these surveys. So what we did was we used the 2017 instrument as a guide to create this current survey here, with adding on a couple new questions to address changes to residencies and GME training. We also removed some questions if the data have not been used in past surveys, or if there was sufficient data obtained from other sources from projects that have been done outside of the survey during that interval window. So we queried 8 total topics with the survey. First, postgraduate training, student loan debt, business management, research experience, clinical experience, fellowship application timing, subspecialty exposure, and residency resources.
Let's talk, first of all, about post-graduation plans. So one of the more surprising features from the survey data was that a very, very high percentage of respondents planned to do a fellowship. I think it was 99% planned to do a fellowship after finishing residency. And then hand in hand with that, what surprised me was when you surveyed residents about their anticipated fields, I think stroke was in the top 3, but then general neurology and neurohospitalist were the other 2 fields within the top 3. So do you have any comment on that? That I know that there are some comprehensive neurology or neurohospitalist neurology fellowship programs, but did that surprise you all as well?
There's several things that could be contributing to these findings. First, I think there's a bit of a stigmatization against pursuing general neurology only at the level of a training. I think we think about, we often ask our trainees, what specialty are you going to go into, or what fellowship are you pursuing? Where we almost hint that there's a need to pursue a fellowship at an early stage in their career. There also seems to be a lack of exposure to general neurology in many large academic centers where many trainees train at the time when these critical decisions are made. Early in training, when fellowship decisions are being decided, there's a very inpatient-heavy training paradigm, partially the need of the hospital, but also partially learning neurology is a lot of times started in an inpatient setting. And while there continues to be some transition to the outpatient, there still remains a very inpatient-heavy burden when those decisions are made. There's an ever-increasing burden of EMR documentation on outpatient providers, which when exposed early, residents often have that on top of their inpatient duties, which can turn residents away from a more outpatient-heavy specialty such as general neurology. I think there's also a concern that residents may or may not feel prepared with the necessary skills after completing residency training, which may be contributing to this as well. So, for example, a lot of people might desire to learn a procedure for practice, such as EEG. So they'll do an epilepsy fellowship, EMG for neuromuscular, Botox, something like that, that they can use or utilize within their general neurology practice, which they might not get enough exposure to in their residency program. And the last thing I think it's important to mention is that this question was a choose all that applies. So it's very possible that people who decide that they want to go into practice and do a fellowship training might actually want to do a mix of the two and mix, say, for example, epilepsy with a little couple days of gen neuro. And will still do the fellowship training to be able to practice a specialty that they're interested in. And I think future studies really need to hone in on this decision-making calculus for why residents decide to pursue a fellowship despite a desire to pursue general neurology. The AAN is really working on this now and trying to tease out this kind of question and also increasing interest in career paths in general neurology. And I think in the coming years, we're going to see a lot more data on that. That's going to really help us guide how residents make these career decisions.
Terrific, Brian. I think that sheds a lot of light on that discrepancy that we were talking about. The other thing that really stood out to me from the survey results was that roughly half of the respondents reported little to no training in business practices. So I assume this was in regards to billing and coding and those sorts of things. I've been out of residency since 2017, and I was trying to reflect on whether or not I actually received formal didactic instruction on billing and coding. I don't recall it, but I may have. Most of my recollection of learning about billing and coding had to do with just being on rounds or in clinic and asking questions. Brian, can you remind me, is this something that residency programs routinely give didactics on, or is it typically taught in the clinic like I remember it? And what were your team's thoughts on this finding of half of the respondents reporting no training in business practices?
We're not totally sure of the landscape of this training at all. And our assumption is that it was taught at some points throughout residency, but the survey data really show that maybe it's not, or maybe it's not signposted correctly so that residents aren't recognizing that they're being taught it. So let me clarify a couple things. In asking this question, we specifically asked residents how do they feel prepared for each of the following and had them rated on a not well to very well scale. So billing, coding, employer contract negotiations, malpractice insurance, office management, meaningful use of the electronic medical records, and RVU-based billing. As we mentioned, in most cases, the overwhelming majority of respondents reported that residency prepared them not well at all or not very well for all of these different subcategories of business management, with the exception of electronic medical records, where that distribution was a little bit more evenly spaced throughout. We also asked in another question if they had any business management training in any of those. So rather than dividing them up into each individual business practice, we lumped them in. And this is where over half of them reported they had no training at all, and a quarter reported they had informal training. This is a little bit surprising for us, actually, because this finding was actually picked up in the 2017 study, and there were a lot of resources that were created as a result of this. And we asked people why or what is their biggest barrier to finding this, and most of them reported that they didn't know that the resources existed, and a lot of them said that they just didn't have time to utilize the resources. And thinking about this finding, I don't know exactly where the best place for this curriculum to be. Should this be didactics or informal training? And I think that's something that we found is an area that needs to be evaluated further. I suspect a combination of both. In my training, we did get a combination of both, where we had several didactic sessions about it, but the vast majority of it was formal in the clinics, practice with our program having us actually practice billing and coding any EEGs that we read, any clinic visits that we saw. I think, as I mentioned, this is a place where we really need further study to get an idea as to what the best way to proceed is. We need to know what works well, what doesn't work well, what people are doing currently, and where we can implement such a curriculum in the setting of a complex and already jam-packed neurology curriculum. We also need to think about what the right platform to teach this curriculum is. Right now, there's a lot of online resources through the AAN. Is that the best platform to teach it? Or should it be one webinar? It's hands-on training. Should it be given more to the programs itself? Another question that I have in thinking about this data is this something that really needs to be explicitly taught in residency? Or should this be either taught on fellowship or on the job or at the end of residency as residents prepare for their jobs? I think this is all information that we don't have at this point, but I really think that this question leaves us with many further questions which need to be systematically evaluated. I think having an understanding of all of these different facets of the response to this question is really going to give us a better idea as to how best to implement this education or this curriculum in order to prepare our residents for practice the best way that we possibly can.
Terrific. Brian, before we wrap up here, any other notable findings that you all gathered from these survey results?
Yeah, I think two areas that we noted that were interesting and reassuring is that, most people, 2/3 of our respondents, felt that they had dedicated research time and overall felt that they were happy with their research time during residency. We did notice some barriers to research, such as the administrative and clinical duties, and some people reported inadequate training in research skills, but about the vast majority of our respondents felt like they did have a good exposure to research. And the other thing that people noted was that their continuity of patients in their continuity clinics was excellent. And they felt strongly that they had some excellent continuity within their clinics, which I think is really important, especially when we think about neurology residency over the years and seeing the trajectory of disease. So I think this is something that programs can be proud of and continue to keep up.
Terrific. Check out the full survey results. Again, this was published on May 16th online in Neurology Education. The title of the paper, once again, is Neurology Residency Training in 2022, Insights from the American Academy of Neurology's Resident Survey. Brian, Emmert, thanks so much for joining us. We really appreciate your time today.
Thank you very much for having me on.
This is Stacey Clardy, your podcast editor. If you've enjoyed the podcast, please take a few moments to subscribe, rate, and review the Neurology Podcast through Apple Podcasts, Google Podcasts, Spotify, or wherever you listen. And remember, you can always head to neurology.org/podcast for our full list of past episodes, or you can also search by keyword in your podcast app for any neurology-specific topics you want to learn about.